Thank you, Chief. Appreciate you being here. Good evening, everybody. Look forward to a good meeting. Tonight's invocation and pledge will be delivered by District 10.
We have invited the minister from Smyrna Church of Christ to lead us in prayer. His name is James Rogers. If you want to step forward.
Shall we pray? Unto you, our Heavenly Father, we give thanks for the day and the opportunity to assemble in this capacity. We thank you for the opportunity to approach your throne through the blood of the Christ. We thank you for these men and women who are giving their time to serve our county. And we pray for wisdom for them as they discuss the matters before them, that they might use good judgment in selecting various options to be followed. We thank you for those who've been honored tonight in their service. We ask your blessings upon us as we live for you every day, that we might be good citizens in our county, that we might be good citizens in our state and in our nation. Our Father, we ask your blessings upon our nation. May we seek to serve you in all matters. Thank you for your love for us. In the name of the Christ, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Mr. Clerk, you call the roll, please.
Ladies and gentlemen, you take your handsets. Everybody press yes and stop right there for me, please. Everybody press yes and stop right there. Wait. All right, now press confirm for me, if you would. Everybody press confirm, ladies and gentlemen. Everybody pressing confirm. Excellent. Mr. Chairman, have all 24 present tonight. There is a quorum.
Thank you, Mr. Clerk. Item number 5, approval of the agenda.
Motion to approve.
Second. We have a motion and a second on the agenda. Any changes? All in favor say aye.
Aye.
Any opposed? We have an approved agenda. Item number 6, approval of the minutes of the previous meeting.
Motion to approve.
Second.
Have a motion and a second on the previous meeting's minutes. Any changes? All in favor say aye.
Aye.
Any opposed? Minutes have been approved. Item 7, unfinished business and action thereon by the board. Report of standing committees, planning committee.
No unfinished business.
Thank you, Mr. Chairman. Fiscal Review Committee.
No unfinished business.
Thank you, Madam Chairman. Nominating Committee.
No unfinished business.
Thank you, Mr. Chairman. At this time, we will allow our public comment period per TCA that was approved last year. We have 6 speakers, 3 and 3. Each speaker gets 3 minutes tonight. The topic, all public comment period has to be germane to the agenda, and all 6 speakers are speaking to the resolution on the methadone clinic location in Putnam County. First up, I will call on, and this was basically by order of asking to speak, Dr. Stephen Lloyd. Are you here, sir? Okay. Didn't see you come in. Thank you for being here.
Thank you.
As rules say, for tonight, you have 3 minutes. At the 3-minute mark, I'll let you know. I've got a timer here. I'll give you 15 seconds to wrap up, and then we'll go to the next speaker.
Sure. Hopefully I won't.
I'll start when you're ready.
Okay, I'll try not to take all 3 minutes. Thanks for having me here. My name is Dr. Stephen Lloyd. I am the Chief Medical Officer at Cedar Recovery and will be the Chief Medical Officer for the clinic if it does get to come to Putnam County. We treat people with substance use disorder. Pure and simple. That is a big need in Putnam County. It's a big need in the Upper Cumberland. And you say we're just switching one drug for another, and you're really not. We can make that argument all day long, but the problem we have today, guys, is that fentanyl is killing our kids before they have a chance at recovery. There's a lot of really good things going on in Putnam County, the Upper Cumberland. I'm excited to be a part of them. I'm excited to be a part of our community. But we have a lot of people in this area that have to drive a long way for the treatment that they need, because it's the only thing that will keep them alive in the age of fentanyl. And so that's what we're asking for permission to do. And I know how the resolution is going to go, and I get it. But you need to know, I've had multiple people say, we haven't heard anybody speak up for it. Well, when you hear some of the things that will be said, who's going to speak up for this? There are people out there, we get texts from them all the time. I got a text tonight coming driving up the road just now saying, hey, thank you for doing this. We are going to do it. We're committed to being a part of the community here. We're committed to being a part of the community in Putnam County. And we're committed to helping people with substance use disorder. There's a lot of different pathways to recovery. My friend Will has a place here in Putnam County, and people do well in it, and that's great, and I'm all for it, and I'm all for as many places like that as we can have. But some people don't do well with that. Some people need other things to keep them alive, and we're simply asking for permission to bring that here. And if you want somebody to hold accountable for it, you can hold me accountable. I'll stand here in front of you and tell you I'll be the medical director. I'll provide the best care I can to my patients. I've got the sheriff sitting here behind me. I'm really interested in our incarcerated individuals because I know the rate of substance use disorder in those individuals, and we're absolutely willing to work with the community. And so that's all we're here for, and that's what we ask you for tonight. Thank you.
Thank you, Dr. Lloyd.
Chair, may I ask a question?
We will ask questions when the motion comes up, and the commissioners will. So we can ask questions. You all can speak to the motion. If a motion's made, at that time we can ask questions. This is the public comment period. Thank you. That we will definitely get to that. Next speaker, Mr. Paul Tribbett.
Paul who?
Tribbett. Here you go. I'll show it to you.
Good evening, Mr. Chairman, Commission members. Thank you very much. My name is Paul Tribbett. I'm the Chief Strategy Officer at Cedar Recovery. Been there now for a little over 4 years, but I think I'm the only person standing here today that can say I've been on both the law enforcement side of this issue and the treatment side. Served in law enforcement for 5 years in Bristol, Tennessee before moving to this after my father died of a drug overdose. Went through 3 abstinence-based programs. One of them was a faith-based program called U-Turn for Christ, 13 months, and he didn't make it much longer after that, and it just didn't work for him. I think most importantly, the message I want to convey to this commission tonight, to the mayor and to the great citizens that are here, is our commitment to this community. I do not think for 1 second that this resolution will not pass, and I'm not asking you tonight to even vote against it. I am just here to speak solely that we are committed to this community. We're already here. We have a facility at 1225 South Willow Avenue. We're treating about 200 patients month over month. According to the Substance Abuse and Mental Health Service Administration, you have about 2,500 people here in Putnam County that are 18 or older that have a substance use disorder. All treatment options should be on the table. You're not going to hear us demonize any form of treatment, such as faith-based, abstinence, using medication, not using medication. We support all paths to recovery that is right for that person. So you're not going to hear us demonize any other form of treatment. I hope that each of you received our community engagement plan as well as our good neighbor agreement. I think Mayor Porter should have printed those out for you all. It is our written commitment to be a great neighbor to you all. We're going to have a community advisory board that we will ask certain individuals to sit on so that we can be transparent about the program. We will have open house days that the community comes see. We're going to have considerate hours. There have been issues raised about 931 Elite Sports. It's in the same building. We're going to be the master leaseholder. If they want out of that lease, they can get out of it. But we met with them, and it looks like for about 10 out of the 12 months out of the year, we're not even going to be open at the same times. We are going to make accommodation to not affect their business. We're going to have the entrance on the side or the back so that it's completely out of the public view. And I hate to say that because it's so stigmatizing. It's exactly what it is. But we are committed to this community. If we get the approval of the certificate of need, we will remain committed. Even if this community, if this council votes against us or says, hey, we don't want you here, we're going to stay faithful. We're going to stay committed. We're like the Good Samaritan. We're going to show up. We love people where they are and love them a little too much, let them stay where they're at. Thank you.
Thank you, Mr. Tribbett. Up next, we have Mr. Joshua King.
Hi, ladies and gentlemen. Thank you for having me and allowing me to speak. Started for me in my early 20s. I went through a surgery that required pain medication. I never had a drug problem in my life until I was prescribed the hydrocodone, and I abused it, and eventually that led to Oxycontin use and many other things. 2004 to 2007, I was in a methadone clinic. I have no doubt in my mind the amount that I was using that saved my life. I was there for the right reasons. I did what I was told. I did therapy. Due to a series of unfortunate circumstances, I discontinued going and went back to using. Went to treatment January 4th, 2013, and I've been clean ever since. I am currently the office coordinator for Cedar Recovery's OBOT location on 1225 South Willow. I'm also a CPRS, which is a certified peer recovery specialist. And I get to work daily with patients. I've been in this field since October 15th, 2013, and I love it. It's a blessing every day to get up and to get to work with patients and to try to help those in need. So, thank you guys.
Thank you, Mr. King. Up next to speak is Mr. Will Roberts.
Thank you very much for having me today. I'm here on behalf of True Recovery from drug addiction. I'm the only one in the room that has seen both sides of the MAT coin. I was on methadone in the 1980s. I've got 35 years clean and sober from all drugs, drug-free lifestyle that I've acquired by the power of the God of my understanding. And He enabled me to start to carry a message. It was a very powerful message that you don't have to take drugs. You don't ever have to take drugs again for the rest of your life if that's what you choose to do. The argument is that drug addiction has changed because of fentanyl. Let me tell you something, drug addiction has not changed, and neither has recovery. Recovery is not about satisfying somebody's need for a drug or their perceived need for a drug by giving them another drug. You know, the problem with that message is that you don't take people from one addiction out of another by using another drug. When you do that, you just add another addiction. And I got sober April 18th, 1989 this time, but I was in and out for 11 years. And in that 11-year period, I tried medicine, a lot of medicine. I tried religion. That almost killed me. That's trying to be good enough for God. I tried psychiatry. That almost killed me. And when I came to recovery this time, I was broken. And I was completely broken. People want to take responsibility for their own actions almost never. And the problem is that our society is getting to the point to where we decide, well, we'll just let them have as much drugs as they want. This MAT thing, I think people have a good heart and they're trying to do a good thing. But the bottom line is that when you move from one drug to another drug, all you're doing is substituting one for another, and that's just the truth of it. The only way you're going to get clean and sober and stay that way is to find something greater than you, a power greater than you. I deal with it every single day. We do have a program called LRM, Life Regeneration Ministries. We've got a life recovery program here in Cookeville. We started down here on the square 1 year ago. The second of this month was 1 year ago. And in that period of time, we've had over 20,000 face-to-face contacts. And that represents about 700 people. But in that 20,000 face-to-face contacts, that's morning, noon, and night. We have meetings, we have referral networks, we have resources. We help a whole lot of people, and we're just one of the probably 12, 14 treatment programs around.
15 seconds, Mr. Roberts.
Including Narcotics Anonymous, Alcoholics Anonymous, and many faith-based programs. We just want you to know there is a better way. Thank you.
Thank you, sir. Our next speaker is Mr. Gene Mullins.
Well, I see a few familiar faces up there. I'm a retired chemist, and I actually ran for and was elected to 2 terms on County Commission representing District 10 in 2002 and 2006. I want you to know that a citizens group is circulating a petition urging the state to deny Cedar Recovery's certificate of need. It has 4 major points. 1, that methadone has serious negative health impacts, and that methadone is a DEA Schedule II opiate, which, by the way, puts it in the same category as drugs like OxyContin and fentanyl, the very drugs Cedar Recovery claims it wants people to stop using. 2, that methadone clinics are highly profitable takeover targets. 3, that the Upper Cumberland region has a number of non-medically assisted treatment groups who know our communities and are actively cooperating to overcome opioid use disorder. The difference in approaches between 2 and 3 reminds me of what my father-in-law was fond of quoting: a good name is rather to be chosen than great riches. And the last point is that there are a number of issues with the location and its proximity to a youth sports training facility, a daycare, and the new Parkview School, among others. You've heard methadone clinics portrayed in a positive light tonight. What you haven't heard is Sheriff Ferris describing his early days as a TBI undercover agent, buying methadone in parking lots of methadone clinics from patients who were only too ready and willing to sell their methadone to get money to buy the drugs they really wanted. You haven't heard what a reformed drug dealer told our Friday morning prayer group recently, that methadone was the drug of choice inside the facility where he was incarcerated. You don't have to guess where that methadone came from. You haven't heard what a prosecuting attorney in Van Buren County told me, that methadone users would take most of their allotment right after leaving the Chattanooga clinic and would regularly be found naked, for whatever reason, on the side of 111 after the methadone kicked in. We do not need the negative health issues and potential community problems of methadone, not when we have homegrown, non-medically assisted treatment groups who truly love and care for opioid users and want them to be completely drug-free. I urge you to vote for the resolution opposing the methadone clinic and its certificate of need. Thank you.
Thank you, Mr. Mullins. Our last speaker is Dr. Sullivan Smith.
Thank you, Mr. Chairman and Commission, audience. It's a privilege to be here. Didn't realize it'd be the cleanup batter. But let me tell you, I thought about this a little bit when I first heard about this clinic potentially coming to town. For those of you who don't know me, and I know almost all of you, 35 years as an emergency physician, have worked very closely with our Sheriff's Department. I'm the medical director for the ambulance service. Been a consultant for the Drug Enforcement Administration, and I've testified in front of Congress twice about drugs of abuse. So I thought about it for a little bit, and I thought, is this just me that's opposed to it? And then I talked to my family, and it wasn't just me. So far, I've talked to about 75 people about this proposed clinic, and I haven't found anyone that supports it.
I'm sorry, can you speak?
No, I'm so sorry.
I got people doing
I've talked to about 75 people so far, and not a soul supports this clinic. But then let me put on my other hat. You know, as an emergency physician, working with the EMS, working with law enforcement, and I'm your county medical examiner for, I don't know, a number of years. We used to have a real problem with methadone. That was back during the days of the pain clinics. Once we got a handle on them, the methadone went away, and so did the deaths. I've seen children die. You know, I've seen adults die. We find it at autopsies, and I'm sure we missed some. Those deaths dropped, and it improved the problem of drugs in our community until fentanyl hit. That's a real problem, and I realize Dr. Lloyd said that methadone's a way to treat that. I think there are better ways. I really do. Times change. Methadone's an old drug. You know what one of the first drugs back in the early 1900s was to treat pain? Heroin. Times change. Heroin's a bad drug, and it's now illegal. Mr. Chairman, if I could just have a point of personal privilege for a second. If you're in the audience and you oppose this clinic, would you stand? I yield back. I gave you the thumbnail version. I'm available to each of you at any time to discuss the CON or what methadone is or any of the other drugs or anything else that may come up at your convenience. Thank you.
Thank you, Dr. Okay, moving on to further business. Item 7B, report of special committees. Number 1, hear report on landfill and transfer station fees from the Solid Waste Committee. Mayor Porter.
Mr. Chairman, the Solid Waste Committee met. Mr. Commissioner Hall is the chairman of that committee, and I think he has a motion, but if you're okay, I'll give you some points of that committee and what they discussed. You have it on your iPad, Solid Waste Committee, and I'll try to be brief. I know we've got a long agenda tonight. When you start looking at solid waste, we have about 10 convenience sites across the county that our population takes their trash to, or they have it picked up by a private hauler. Inside the cities provide trash pickup. That garbage is taken to the transfer station where it's then loaded on trucks and it's taken to Athens, Tennessee, to the big landfill up there. We also have a recycling center that handles our recyclables that we talked about the other night in Budget Committee. So down at the landfill, which is on Cooperbalk Road, that is a construction waste landfill. So people that have built houses, construction waste, also tree debris, limbs and those kind of things is taken to that landfill. It's not a garbage site. It's a construction waste and debris that's taken to it. So over the past several years, and until you start looking at some of this, we really hadn't had a problem in keeping up with all that. But all of a sudden in the last 2 years, we've had a 15% increase in the cost of operating those facilities just in 2 years. You go back further than that, it's been even more than that. Prices were staying pretty steady about the fees we were paying to have the garbage hauled to the landfill, the price it was costing to operate the construction waste landfill, but especially with inflation that we've seen in the last 2 or 3 years, we really went up. And we got to looking, there's not been an increase in the fees at either one of those places in the last 23 years. We've kept those fees have been the same from what we went back and researched all the way back to 2001. So the transfer station fee right now is $45 and the landfill fee is $35 per ton. The citizens don't pay. That's the commercial haulers and the private haulers and everyone. We started looking at other counties. As you look on your thing, Overton County for their transfer station charges $100 per ton. Smith is $100. You start looking over those counties around in Tennessee that we pull, the average is almost $60 per ton fee that they charge. When you look at the construction waste, about $70 per ton is the average that we're seeing. So what the committee came up with, and I'll let the chairman make that motion, but looked at increasing the transfer station fee $5, and then increasing the landfill fee $15, so they're both $50 per ton. So there's no confusion as to whether you're going to the transfer station or to the landfill. The citizens don't pay this, as we said. They're taking their garbage to the convenience sites or someone's hauling it for them. And then shingles is our number one problem, roofing shingles. We're getting those, they take up a lot of room in the landfill, and so we're asking for $100. The committee's recommending $100 on the shingles because we have, seems like folks coming from other counties that are bringing shingles to our landfill because it costs $100 to take them to these other 2 landfills around us. And the fees that they're asking for would only go into effect August 1st, giving everybody time for that $5 increase and for the $15 increase at the landfill. And I'll turn it over to Chairman Hall.
Thanks, sir. two things. One, I want to address the gentlemen and ladies up here sitting with me. If you're put on a committee and you show up 5 minutes after the meeting starts, they name you chairman. The Solid Waste Committee recommends raising the tipping fee for commercial haulers to $50 per ton at both the transfer station and the landfill, and the fee for roofing shingles goes to $100 per ton. This fee increase would take effect August 1st this year. That's our recommendation.
That's a motion, Commissioner Hall?
That's a motion.
I second.
Okay, we have a motion and a second. Any discussion, please hit your button on, Mayor Porter, you got something else to say?
I just want to say one other thing, Mr. Chairman. Nobody on the committee, and including myself, doesn't want to raise any of the fees. We don't want to do that. But we're just trying to break even on the landfill and the transfer station, not making any extra, just trying to break even with inflation. So I'll make sure y'all knew that.
All right, we have a motion and a second. We'll do a roll call on this because we're changing the process, but any discussion? All right, Mr. Clerk, when you're ready, please call the roll.
All right, seeing none, if you take your handsets, if you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote, and then stop right there for me. Wait. Stop right there. Let's get the votes in first, please.
Mr. Andrews steps out for a second.
All right, hang on.
Darren, will you take that to the bathroom for him? I'm just kidding. I'm kidding.
What is it?
I was going to tell you to take his handset to the bathroom for him, but
Go ahead.
it's a joke. Happy birthday to you, Darren.
Thank you.
Yeah. Are you feeling the love, brother?
He abstains.
Well, we can. You want to abstain him on this round, or just wait?
I'd rather wait.
All right.
He's present, so I'd rather
He is
wait.
present. There he is.
Commissioner Andrews, we have a motion, a second on the floor to increase the fees that Randy presented for solid waste. So we have to do a roll call vote. So
If you favor the motion, vote yes.
if you favor that motion, vote yes.
Do not
Commissioner
vote no.
Andrews.
All right. Go ahead and vote, David. Go ahead and vote.
I did it.
There you go.
There we go.
Now, all votes are in. Anyone wish to change their votes anywhere? Now, please press confirm for me, ladies and gentlemen. Everybody press confirm for me. Excellent. Mr. Chairman, we have 24 voting yes, 0 no. When the roll is called, I declare that motion to have passed.
Thank you, Mr. Clerk. Item 7C, other unfinished business. Okay, moving on. Item 8A, report of standing committees. Planning Committee.
Thank you, Mr. Chairman. Item A, under planning, recommends approval of the road committee's speed limit proposal for Sandy Stone Camp Road, and I so move.
Second.
All right, we have a motion second. Any discussion? All in favor say aye.
Aye.
Any opposed? Motion passes.
Item B, planning committee recommends approval of the road committee's proposal for Welch Hollow Road, county road map status, which is to remove it from the county map, and I so move.
Second.
Okay, we have a motion second on that. Any discussion? All in favor say aye.
Aye.
Any opposed? That motion passes.
Mr. Chairman, item B. C, recommends approval of the resolution opposing proposed new methadone clinic in Putnam County, and I will turn that over to you.
Second.
All right, we have a motion on that. Somebody say something?
Second.
Well, we don't have a motion. Or he didn't make a motion.
Oh, I thought he put it in the form of a motion.
Is that a motion?
I make a motion
Okay.
to.
That one did second.
Second.
Okay, we have a motion and a second. I know there's going to be some discussion. Commissioners, you can ask questions to the speakers that presented. I'm going to ask you to keep the discussion to a minimum. We ask our guests to do that, so let's keep this discussion to a minimum for those that want to talk. So if you want to speak, hit your button. Commissioner Donadio.
Dr. Lloyd, if I may ask you a question, please.
Yes, thank you.
All right, so a number of years ago in Johnson City, there was another company that attempted to put a opioid treatment facility using methadone as the medical adjunct. You opposed that. Can you please explain your change of heart on this particular medication for treatment?
I wasn't opposed to medication. I was opposed to the lowlifes that were trying to bring it there. They had a long history of covering up things that should not have been covered up. So they had people in their clinic who had overdosed while they'd been at their clinic, and then whenever they came to investigate, they said that they had died after they left the clinic, and they had been cited for that. They were backed by private equity. They had a bunch of clinics around, didn't care anything at all about patients, and that wasn't what we needed in Johnson City, which is where I lived at the time, where I grew up. The clinic that's there now, I helped establish as a cooperation between East Tennessee State University and the health system to bring medically assisted treatment the way it needed to be done. Because, out of everybody I've listened to, I love Will, and what Will said is right. That is the path to recovery. It's the path that I took, but I disagree with Will on fentanyl. Fentanyl changed the ballgame. And it is different. Addiction's the same, but fentanyl is certainly not the same. You don't have to be a drug user to die of an overdose now. You take one pill and you die. And we have to do what we can to keep kids alive to help them find their path to recovery. So that is what I do. It's what I do on a daily basis. And you're exactly right about the clinic there, because it wasn't what we needed, because they didn't come before our county commission. They didn't come before our city commission. They made no attempt to be involved in our community at all. They were all about seeing how much money they could make, and it's not what we needed in the Tri-Cities, and we didn't have it.
I also have some prepared comments, if that's okay.
Thank you, Dr. Lloyd.
Thank you, sir.
Yes, sir.
Go ahead, Commissioner Donahue.
Thank you. I don't understand addiction. I've never suffered from addiction. As a young sailor in the Navy back in the 80s, I smoked. Why? Because it had built-in smoke breaks. One day I just decided I'm not going to do this anymore. And I laid down the cigarettes and didn't buy anymore. Never felt the urge to have one. I wasn't addicted. Other people aren't so lucky. They do become addicted to nicotine, alcohol, opioids, or other things, or be a part of it or live with it. I don't have that, and I'm glad I don't have that. What I'm about to lay out to you are facts, as I understand them. There may be some errors, but in my studies, that's what I understand. Everything I'm about to say is correct. Please don't confuse my acknowledgement of the facts and the candid way I approach this with approval. I don't. I have a healthcare background, and although I'm not a physician, I do hold the Doctor of Nursing Practice and have taken coursework in pharmacology. I'm not going to bore you with the details, but currently there's 3 major medications approved for treatment of opioid use disorder. There's buprenorphine, commonly prescribed as Suboxone. There's naltrexone and methadone. Each one works differently in medicated assisted therapy, and each is approved by the FDA and the state of Tennessee. Those are facts that none of us can change. We cannot fix that. Our state legislators can fix that, but we can't fix that. We may believe that there are other better methods of fighting addiction. I understand that, sir. But these medications have, right or wrong, received approval for use. Right now, as I said, none of us can change that. I would ask you to write your state and federal legislators if you want to see that changed, because I do. To the matter at hand, Cedar Recovery is applying for a certificate of need from the state of Tennessee per the state health plan. It says right here, state health plan. The state health plan outlines a criteria for approving such a certificate. The criteria centers around healthy lives, access, economic efficiency, quality of care, and workforce. That's what if you have a chance to read it, that's what it centers around. These are the criteria. Unfortunately, what none of us heard in the criteria is community sentiment. It's not there, and I wish it was. I've talked to many constituents, fielded 24 phone calls over the last few days, and attended a meeting this Saturday with no less than 350 members of our community who do not want Cedar Recovery expanding their operations from the currently offered Suboxone and naltrexone treatments at their South Willow location to methadone at the Burgess Falls location. The unfortunate reality is that the Tennessee Facilities Commission while they may weigh our sentiments, is going to make this decision based on the criteria in the state health plan. That's what they're going to do. Do I encourage you to make your sentiments known? Resoundingly, yes. Write your letters. Please do. But the community for the community to have a realistic chance of prevailing, our protests need to be based in the health plan's criteria. That's where we need to focus. I've heard comments about traffic, proximity to local churches, Upper Cumberland Fieldhouse, and concerns about the medication, methadone itself. And I acknowledge those concerns. But we must remember the board will make its decision based on the established criteria in the state health plan. On May 30th, I sat down with Dr. Lloyd and Mr. Trivett to learn more about them and their plans for Putnam County, the 7th District, where I'm the county commissioner, where they intend to put this clinic. Do I believe they believe in treatment they are offering? I do. Do I believe they believe what they're doing saves lives? I do. Do I believe there's a profit motive? I do. Okay, there's certainly money that's going to be made. But what health agency besides the state or federal nonprofits doesn't? So we have to make logical arguments that work in addressing the state health plan. That's what we have to do. I hate what opioids like fentanyl and heroin have done to this nation. I hate that the Democrat Party has fought at every turn attempts to control the southern border and to at least slow down from getting this poison from getting into our communities, schools, and our homes. I'm not happy that because of the amount of opioid addiction we are seeing in the Upper Cumberland, Cedar Recovery is likely to prevail and receive the certificate of need. But I'll be voting in the affirmative against this resolution. Dr. Lloyd, Mr. Trivett, I represent the people of the 7th District. They have voiced their opinion. To them in Putnam County, I make this promise. If you are granted the certificate of need and you open the treatment facility on Burgess Falls Road, I will expect you to hold to the submitted community engagement plan, and I will do everything I can do to make sure that you abide by this community engagement plan. If you haven't read it, I suggest you do. I will hold you to this. Thank you.
Thank you, Commissioner Nadio. Commissioner Randolph.
I just want to make a statement. Based on the people that I have heard from in my district, District 10, the vast majority of my constituents in District 10, mine and Kim's, are desperately opposed to a methadone clinic in Putnam County. And I just want to go on record for District 10 that we do not want it here. Thank you.
Thank you, Commissioner Randolph. Commissioner Eldridge.
Got a question for Mr. Trixel.
We have a question for, I'm sorry, which one? Mr. Trivett. I'm sorry, I couldn't hear what you were saying, Chad.
Yes, sir. Thank you for being here tonight.
Yes, sir.
You said you guys are looking after about 200 patients a month at your current clinic?
Yes, sir.
How many are now currently clean or not using drugs?
So this is where probably the biggest point of controversy comes into this. It is if you take medication such as buprenorphine, methadone, naltrexone, are you in recovery or are you not? So when we look at the definition of addiction, addiction just doesn't say that somebody's using drugs. It talks about somebody that has a pattern of behaviors that leads to consequences, and they continue those despite those consequences. Even more so, it is important to note that when a person walks into one of our facilities, we say, hey, you don't have to be on this medicine. It may not even be right for you. They have to meet clinical criteria, so that's what we follow. So the metrics that we look at are your social determinants of health, which is your housing, your food, your legal issues, those kind of things. The medicine is not treatment. The medicine is to quell those cravings so that they can focus on the therapy, the counseling, the peer recovery support that we provide. So I want to answer your question just outright. We have today those 200 people that are pursuing active recovery in our facility month over month. The Substance Abuse and Mental Health Services Administration, the Tennessee Department of Mental Health and Substance Abuse Services, TennCare, the federal government, and our malpractice insurance tells us that we are not authorized to force anybody off of any medications. So we do not force it. We work on their individualized treatment plan. As they want to taper down or off, as it's recommended, then we work towards that.
So your hands are tied.
Our hands are tied. But if I could tell you, just real quick, Councilman Eldridge on this, if it was trained a drug for a drug, we'd have 100% retention and care, because most people don't pay for anything when they come to our facility. We take Medicaid, Medicare, insurance, and we get grant funding from the Department of Mental Health. The problem is we don't just give them drugs. We don't give them medications. They have to be engaged in counseling, case management, therapy. They have to follow an individualized treatment plan. So our retention rate right now after 6 months is about 53%. After 1 year, it's about 42 to 43%. We see substantial improvement in the lives of people that stay retained in care.
I've got 2 more quick questions for you.
Yes, sir.
Would you also be in a situation where your hands would potentially be tied with methadone?
In terms of forced tapering people off of it? Mm-hmm. Yes, sir. So in 2018, Lieutenant Governor Randy McNally pushed forth a bill that would have mandated a tapering for every treatment facility in the state of Tennessee, tapering people off of methadone, buprenorphine, or Vivitrol. They would have a mandated timeline. There was a lot of opposition to that, as you can imagine, because the health outcomes and the overdose outcomes associated with that are very poor. Most importantly, the classification from the Americans with Disabilities Act is that these individuals, if taking these medications, are protected, and they're by definition a recovery. So I'm trying to give you more of an answer to kind of try to help paint this picture. The state of Tennessee prohibits anybody from initiating more than 30 milligrams of methadone when they enter into a facility. A person cannot walk just simply into one of these programs. I'm not going to call it a methadone program because it's stigmatizing. It's an opioid treatment program. They cannot walk in and simply get methadone. You have to be in active withdrawals. You have to meet clinical criteria for that, and then you're authorized to start on the 30 milligrams. They have to be told at the beginning and sign an informed consent that if the medication is appropriate and they choose to take it, they can taper down or off at any time, and it may be recommended by their healthcare provider to do so. I think the most important thing I want to say to Councilman Eldridge is that there will be people that walk into this proposed facility, if we get the certificate of need, that may be seeking our help that will not receive it because they meet indication for higher levels of care. We have to follow what the American Society of Addiction Medicine says. So it will always be an option. It will always be advised, but we cannot force anybody off of it.
I think that's a fear for most people, because what we've heard tonight from some people is most addicts, no matter what their drug of choice is, don't stop until they've hit some sort of wall.
Yeah.
So if your hand, I truly believe, like AJ said, that I think you really are trying to do something great. I commend you for that, but that's a real fear I think everybody has. No matter how much they want to do it, you can't force them. I can't force them.
Yes, sir.
And if your hands are tied on top of that, to where you have to give it to them.
Yes, sir.
And if your hands are tied past that, to where you have to give it to them.
May I respond to that, Councilman? Is that okay? We see people's lives getting better. We do have standard assessments that we follow that are evidence-based. We see people get jobs, get their housing back, don't go back to jail. That's why we have a diversion center in Wilson County, Tennessee, with the district attorney and the sheriff to keep people out of jail. The medicine component is not the focus. The disease of addiction that causes behaviors that lead to those things, like my father experienced when I wrestled a gun out of his mouth at 15 years old, and he went on to substantially harm our family and eventually cost his life. He was sick. If my father, because I was a cop, I hated this. I was opposed to it. I stood in the audience and said, "Don't bring it here." But today, if my dad had to take medicine to be alive and be healthy, I'm good with that.
Thank you.
Sir.
Thank you. Commissioner Williams?
Yes, my question is for Dr. Lloyd again. First of all, thank you for coming. Thank you for being in the unpleasant position of having to defend an unpopular thing. Okay? And I appreciate your perspective. My question for you is in reference to the question and answer, a frequently asked question page. And the number 2 was how is methadone administered? It's administered daily in a facility by a nurse. That part's fine. Take-home doses are allowed under special circumstances dictated by federal and state laws. That's what I want. What are those special circumstances that allow people to take it out of the clinic?
Time and compliance in the program. And that is set forth by the DEA and the states. States usually have a further restriction on it than the DEA does. Federally, they've been pulling back on it, and I don't agree with it because a lot of stuff that's been said tonight is absolutely true. It's a really dangerous drug. The first 2 weeks are always iffy because of the way it's eliminated from the body. You can have dose stacking, and somebody can overdose really easy. So it is a very complicated drug. The reason that we put ourselves through this is because for some of our folks, it's the only thing that'll keep them alive. And I hope we have something better, and hopefully that'll be soon. But to get to the gist of your question, it's time and compliance in the program. So in order to get 2 days worth of take-homes, you've got to be compliant with everything, meaning drug screens being consistent, compliant with your therapy, compliant with showing up every day for 6 months.
So are these, would you say that these take-home doses are your primary source of diversion?
Well, I mean, that would be about the only way I could figure out how to divert it would be take-homes. Absolutely.
So these take-home doses are the doses that end up on the street?
Well, yes. They would be the only ones that I could think of that could. Everybody else has to stand there in front of a dosing nurse. And the protocol is that they've got a glass of water right there in front of me. There's a little window and a curtain or a door behind you. Take a glass of water, drink the water. Methadone is liquid. Okay, so then they take the methadone and then they take another glass of another sip of water while you're talking to them. So I'm not saying you couldn't divert it; it'd be really hard. So the ones that would be up for diversion would be the take-home doses. Yes, sir.
And how long does a person have to be compliant with the program before they're allowed to do take-home?
6 months minimum to get 1 day.
Okay. Yeah. That was my question.
Yes, sir.
Thank you. Commissioner Hall?
Doctor, you answered several of my questions. The one that kind of concerns me is once a person is dosed at your facility, does that alter their ability to operate a motor vehicle?
According to everybody who's in the know, it doesn't if you're dosing them properly. So one of the things you get concerned about would be other things that they're taking, that they combine it with the methadone. The big one we always watch out for is benzodiazepines, like Valium, Xanax, Klonopin, those type of drugs. It's a lethal mix. And sometimes you're at the mercy of what the person tells you, so you don't know if they're doing that or not. So the entire staff is trained on recognizing signs and symptoms of impairment. And so we have a clinic, or I have a clinic in Newport, Tennessee, Cocke County. There's been numerous occasions, Commissioner Hall, where we had to not let somebody leave. You are not okay to drive, and we will not let you drive, and we will take your keys, and we'll call you an Uber, or we'll do what we have to do to get you home. But that's a responsibility of the clinic.
Thank you, sir.
Yes, sir.
Commissioner Jacinto?
Question, Dr. Lloyd. Kind of straight up, methadones are pretty profitable business clinics, aren't they?
Yeah. Yes.
Yeah, you mentioned earlier that private equity firms were involved in it. It's pretty common for these to start up and then get rolled up, acquired. So you've put together all of this about how you're going to be there with our community, but the reality of it is most of these clinics get rolled up and sold to private equity firms, don't they?
Right. So I can't speak to that because I've never sold one to a private equity firm, and the one in Newport has been there for 4 years, and I own it, and I have no intention to sell it. Profit is not the motive for a methadone clinic here. The motive for a methadone clinic in Putnam County is to give people access to this level of treatment that need it, and my track record speaks to that. If we sold to a private equity clinic, it'll be over every ounce of my proposal that I can possibly do. I'm in recovery myself for almost 20 years. I try to help people find a path to recovery that's right for them, Commissioner Jacinto, and that's what this is about. I wish there was a better drug, and I've got a feeling in the next 5 years there will be another better drug. I have to know a little bit about what's in the pipeline. But right now, this is what we have. If we sell to a private equity firm, it will not be with my blessing.
Thank you.
Yes, sir.
Okay. Thank you, Dr. Lloyd.
You bet. Thank you all.
All right. Any more discussion? We have a motion second. We're ready to call for a vote. All in favor say aye. Aye. Any opposed? Okay, the motion passes.
That concludes planning.
Thank you, Mr. Chairman. Fiscal Review Committee.
Thank you. First up, item A, recommend approval of budget amendments to the county general fund, and I so move.
Second.
Have a motion second. Discussion. Mr. Clerk.
All right, sit down and take your handsets, ladies and gentlemen. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. And stop right there for me. Everyone is voting, and stop right there. Mr. Riddle. All votes are in. Anyone wish to change? Wait. All votes are in. Anyone wish to change their vote anywhere? Now press confirm for me, ladies and gentlemen. Everybody press confirm. Mr. Moss. Good deal. Mr. Chairman, 22 voting yes, 0 no. I declare that motion to have passed. Madam Chair.
Thank you. Item B recommends approval of budget amendments to the solid waste fund, and I so move.
Second.
We have a motion second. Any discussion? Mr. Clerk.
Ladies and gentlemen, take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there. Please do not confirm. Mr. Sandlin. All votes are in. Anyone wish to change their vote anywhere? Now, please press confirm, if you would, ladies and gentlemen. Please wait till I get past asking for a change in votes, because we'll get ourselves locked out if we're not careful. Then we'll have to do a reset. Thanks.
Don't break your quick.
Mr. Chairman, I have 24 voting yes, 0 no. Declare that motion to have passed. 3.
Thank you. Item C recommends approval of budget amendments to the Health Department Opioid Abatement Fund, and I so move.
Second.
We have a motion second. Any discussion? Mr. Clerk.
Take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. And stop right there. All votes are in. Anyone wish to change their vote anywhere? Now, please press confirm for me, ladies and gentlemen. Thank you very much. Excellent. Mr. Chairman, with 24 voting yes, 0 no, declare that motion to have passed.
Thank you.
Madam Chair.
Item D recommends approval of budget amendments to the American Rescue Plan Fund, and I so move.
Second.
A motion and second. Any discussion? Mr. Clerk.
Take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Please stop right there. All votes are in. Anyone wish to change their vote anywhere? Now, please press confirm, ladies and gentlemen. Thank you very much. You're doing great. Madam Chair, Mr. Chairman, I have 24 voting yes, 0 no. I declare that motion to have passed. Madam Chair.
Thank you. Item E recommends approval of budget amendments to the Debt Service Fund, and I so move.
Second.
We have a motion and second. Any discussion on the motion? Mr. Clerk, are you ready?
Take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there for me, please. All right. All votes are in. Anyone wish to change their vote anywhere? Please now press confirm for me, ladies and gentlemen. Everybody press confirm. Mr. Chairman, with 24 voting yes, 0 no, I declare that motion to have passed. Madam Chair.
Thank you. Item F recommends approval of budget amendments to the Capital Projects Fund, and I so move.
Second.
We have a motion and a second. Any discussion on the motion? All right, Mr. Clerk.
All right, seeing none, take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there. All votes are in. Anyone wish to change their vote anywhere, please now press confirm for me, ladies and gentlemen. You're doing awesome. Thank you. Mr. Cassidy.
Mr. Cassidy.
Mr. Chairman, with 24 voting yes, 0 no, I declare that motion to have passed. Madam Chair.
Thank you. Item G recommends approval of budget amendments to the Road Department Fund, and I so move.
Second.
We have a motion and a second on the motion. Have a motion and a second. Do we have any discussion? All right, Mr. Clerk. Whatever.
All right, seeing none, take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there for me. All votes are in. Anyone wish to change their vote anywhere, please now press confirm for me, ladies and gentlemen. Mr. Chairman, with 24 voting yes, 0 no, declare that motion to have passed. Madam Chair.
Thank you. Item H recommends approval of budget amendments to the General Purpose School Fund, and I so move.
Second.
We have a motion and a second. Any discussion on the motion? Mr. Clerk, when you're ready.
All right, seeing none, take your handsets. If you favor the motion, vote yes. If not in favor of the motion, vote no. Everyone, please vote. Stop right there. All votes are in. Anyone wish to change their vote anywhere, please now press confirm for me, ladies and gentlemen. Mr. Chairman, with 24 voting yes, 0 no, I declare that motion to have passed. Thank you, Madam Chair.
Thank you. Item I recommends approval of budget amendments to the School Nutrition Fund, and I so move.
Second.
We have a motion and a second. Any discussion on the motion? Mr. Clerk, whenever you're ready.
Seeing none, take your handsets. If you favor the motion, vote yes. If not in favor of the motion, vote no. Everyone, please vote. Stop right there. Mr. Riddle. All votes are in. Anyone wish to change their vote anywhere, now please press confirm for me, ladies and gentlemen. Ms. Dunn.
Yes.
Ms. Dunn, hit confirm, please, for us. Thank you.
There you go. Mr. Chairman, 24 voting yes, 0 no. Declare that motion to have passed. Madam Chair.
Thank you. Item J recommends approval for the Putnam County Emergency Services to write off uncollectible debt in the amount of $655,624.23, and I so move.
Second.
We have a motion and a second. Any discussion? Mr. Clerk, whenever you're ready.
All right, take your handsets. If you favor the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Please stop right there. Wait. Don't confirm yet. All votes are in. Anyone wish to change their vote anywhere, now please press confirm for me. Thank you. All right. Mr. Chairman, 24 voting yes, 0 no. Declare that motion to have passed. Madam Chair.
Thank you. Item K recommends approval for the Solid Waste Department to write off uncollectible debt in the amount of $276.32, and I so move.
Second.
We have a motion second. Any discussion? Mr. Clerk?
All right, seeing none, take your handsets. Favor the motion, vote yes. If not favor the motion, vote no. Everyone, please vote. Please stop right there. All votes are in. Anyone wants to change their vote anywhere, please press confirm for me, if you would, ladies and gentlemen. Mr. Chairman, we have 24 voting yes, 0 no. I declare that motion to have passed. Madam Chair.
Item L recommends approval for the Register of Deeds Office to file for 2 grants in the amount of $350,000 with no match, and one for $150,000 with a 25% match to digitize the old record books, and I so move.
Second.
We have a motion second. Any discussion? All right, since we're just applying for a grant, we've not received any money, we're not spending any money, we can do a voice vote. All in favor say aye.
Aye.
Any opposed? That motion passes.
Item M recommends approval of the resolution to request unclaimed property back from the state, and I so move.
Second.
All right, we have a motion second. Any discussion? Same situation here. We're not receiving any money or paying any money, so we do a voice vote. All in favor say aye.
Aye.
Any opposed? That motion passes.
Item N, discuss resolution to establish Putnam County Jail with a work release program.
Motion to approve.
Have a motion second. Any discussion? Okay, we'll have to do a roll call on this one.
I've got a quick comment on that. I was trying to.
I'm sorry, I hit to vote a second ago, and I realized we're past that. I'm sorry, I can't go back. So
Go ahead,
we're at voting, so please don't hit your handsets yet. Okay?
Don't vote yet.
Don't vote yet.
Go ahead.
I just want to thank Sheriff Ferris for researching this for us. Commissioner Andrews and myself were a couple of the ones that were made aware of TCA 41-2102. That was something that we were not able to pursue with our old jail. The sheriff did a lot of work, a lot of diligent work at doing it, but more importantly, he's not required to do this. It's something that he agreed to do on our request. It takes on a lot of other liability. It's got a lot of positive things in a lot of other counties, and on behalf of me, and I'm sure Commissioner Andrews would mimic that, we thank you for stepping up and putting this in place.
All right. Anybody else? Mr. Clerk, whenever you're ready.
All right, ladies and gentlemen, take your handsets. If you favor this motion, vote yes. If you not favor the motion, vote no. Everyone, please vote, and please stop right there. All votes are in. Anyone wants to change your vote anywhere, please press confirm now, ladies and gentlemen. Everybody press confirm.
Commissioner Andrews.
I must have the lame one tonight.
Mr. Chairman, with 24 voting yes, 0 no, declare that motion to have passed. Thank you, Madam Chair.
Thank you. Item O recommends approval of tax freeze resolution, and I so move.
Second.
Motion second. Any discussion? So we'll have to do a roll call vote on this one because we need a required 2/3 vote to approve. So, Mr. Clerk, whenever you're ready.
All right, ladies and gentlemen, if you favor the motion, take your handsets and vote yes. If you not favor the motion, vote no. Everyone, please vote, and then stop right there. All right, you have. All votes are in. Anyone wish to change their vote anywhere? Now, please press confirm for me, ladies and gentlemen. Thank you. Mr. Chairman, I see 24 voting yes, 0 voting no. I declare that motion to have passed.
Item P recommends approval of a resolution authorizing the issuance of general obligation school bonds of Putnam County Tennessee in the aggregate principal amount of not to exceed $13 million in one or more series, making provision for the issuance, sale, and payment of said bonds, establishing the terms thereof and the disposition of proceeds therefrom, and providing for the levy of taxes for the payment of principal of premium, if any, and interest on the bonds, giving the county mayor the authority to sign all documents needed to complete this transaction, and I so move.
Second.
We have a motion and a second. Any discussion on the debt resolution? Mr. Clerk, whenever you're ready, please.
Ladies and gentlemen, take your handsets. If you're in favor of the motion, vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Stop right there for me, please. All votes are in. Anyone wish to change their vote anywhere? Please press confirm for me now, ladies and gentlemen.
Mr. Chairman, I believe I need a new battery.
Mr. Chairman, 24 voting yes, 0 no. I declare that motion to have passed. Madam Chair.
All right. Item Q recommends approval of the consideration of GASB 34 amendments as well as any cleanup amendments in order to properly close out the fiscal year. And I so move.
Second.
Motion and second. Any discussion on GASB 34 amendments? Or GASB amendments, period? Mr. Clerk, whenever you're ready.
All right, ladies and gentlemen, take your handsets in favor of the motion. Vote yes. If you're not in favor of the motion, vote no. Everyone, please vote. Wow, you did great. Any new motion to change your vote anywhere? You're getting good. Press confirm for me, if you would, ladies and gentlemen. Everybody, press confirm. You're doing great. Chairman, 24 voting yes, 0 no. Declare that motion to have passed. Madam Chair.
Thank you, and that concludes fiscal review.
Great job, Madam Chairman.
Yes.
Thank you, Mr. Clerk.
Thank you. Thank you, sir.
All right, nominating committee.
Yes, nominating committee recommends approval of the appointment of the following members to the Putnam County Board of Health as follows, with terms to expire in June of 2027. The county mayor, director of schools or designee, Clarence Smith, pharmacist, Jeff Crozier, physician, Stacy Brewington, physician, Scott Brown, dentist, Bethany Pack, RN, and I so move.
Second.
Motion second. Any discussion? All in favor say aye.
Aye.
Any opposed? Motion passes.
And that concludes nominating.
Thank you, Mr. Chairman. Report of special committees. Resolutions.
No resolution, Mr. Chairman.
Election of notaries.
Ladies and gentlemen, this is a long one. 40-something on here. Here we go. Brenda F. Ossebrooks, Wade Blair, Crystal Bond, William Brooks, Ricky Cherry, Michelle D. Coe, Penny Daugherty, Mackenzie J. Delanty, Brooke Ferguson, Ruth Ann Fields, Lisa D. Finch, Dylan C. Fisher, Casey Flatt, Joel Gardner, Cody L. Gardner, D. Roberto Garrido, Jacob Giddings, Tina Girdley, Andre Greppin, William P. Holcomb, Josie Hamilton, Jimmy Joe Hodge, Christy Huddleston, Tony B. Hudson, Caitlin Jones, Ben A. Kilgrove, John Edward Langford, Leslie M. Langford, Chad Long, Melanie G. Madewell, Bonnie A. McLaren, Raymond Mead, Crystal Meadows, Robert L. Miller, Stacy M. Nash, Alicia Phelps, Anthony Pafanelli, Lindsay Pomalis, Daniel H. Rader IV, I did good on those words, Amy J. Soto, Angela Van Dett, Gail Waters, Stacy Lynn Whiting, and last, Jenna B. Wilkin.
Motion to approve.
Second.
Motion second. Discussion. Mr. Clerk.
Take your handsets. If you favor the motion, vote yes. These have already been approved by my office. Go ahead and press confirm for me, if you would, ladies and gentlemen. All these folks got everything together finally by early this morning. Thank you very, very much. Mr. Chairman, I have all 24 voting yes on the notice. I declare that motion to have passed. Thank you, sir.
All right, other new business? Announcements and statements, Sheriff?
I'll be quick. I just want everybody to know, won't you put it on the calendar there, we're going to have the grand opening for the jail edition on July the 25th at 2 p.m. That's the ribbon cutting. Please put it on the calendar. I'd like for each of you to be there. The mayor and I and all the commission, you and the former sheriffs and everybody will be doing that. We'll have open house that day from 2 to 4. That's on a Thursday. We'll also have open house the next day, which is Friday, from 10 to 2. So hope you come. You're more welcome to come from now till then, anytime if you want a tour. We'll certainly give it to you, but it's getting really close to being open and we're excited about it, but look forward to having everybody there. Just wanted to tell you in advance to get it on the calendar. Thank you.
Thank you, Sheriff. Anyone else? Thank you all for your patience. Thank you everybody in attendance for being here, your professionalism. Thank you to the speakers. They're professional. Appreciate that effort and the cooperation. Happy 4th of July. Have a safe one. Mr. Wilson, happy birthday again. Can I get a motion to adjourn?
Motion to adjourn.
We are adjourned.